What are mutation-driven MDS treatments, Dr. Bejar?
So mutation-driven MDS treatments are therapies that are selected in part because of the mutations that we identify in patients with MDS. Often, these are therapies that specifically target the mutation in question. For example, rare patients with MDS can have mutations in genes called IDH1 or IDH2. And these are genes that are mutated in about 5 to 7% of patients with MDS. And we have certain drugs that specifically target the genetic change that leads to these mutations that causes the disease. And these can be effective and are increasingly available to patients as they are becoming FDA approved in other conditions. But for the most part, our greatest therapy that is driven by genetics is the therapy called lenalidomide. Lenalidomide is an oral drug that treats patients, particularly who have a deletion in chromosome 5q. So deletion of chromosome 5q predicts an increased response to lenalidomide, a greater depth of response and greater duration of response compared to patients who are treated with lenalidomide who don't have this deletion 5q. One important point I'd like to make about this is that the patient has to have a deletion of chromosome 5q either in isolation or in the presence of only one other chromosomal abnormality that doesn't involve chromosome 7. Chromosome deletions of 5q are fairly common in patients that have multiple chromosomal mutations, 3, 4, 5, or even more. And in that setting, lenalidomide is not an effective agent. So you have to ask about whether or not the deletion chromosome 5q is present in isolation. And finally, there are other targeted agents that we sometimes use in patients with MDS if they have a rare genetic mutation that suggests they might be susceptible. So occasionally a patient with advanced MDS or higher risk MDS will develop a mutation in a gene called FLT3. This is a gene that's often associated with progression to acute myeloid leukemia. And like the inhibitors of IDH1 and IDH2, we have inhibitors of FLT3 that we might use in that context. But for the most part, we still have a long way to go to develop genetically targeted therapies in MDS, even though we do have some insight into how we can do that today.